everyone. Welcome to our podcast. Today, we are going to be talking about empowering PBC patients and the APP role in education and support. I'm Sarah Dawkins. I'm a nurse practitioner at Duke University Medical Center, and I'm joined by Alison Moe.
I'm Alison Moe. I'm a PA with Atlanta Gastroenterology Associates, a division of United Digestive in Atlanta, Georgia. And as Sarah mentioned, we're here today to talk about empowering our patients who have PBC, a known and sometimes complicated chronic liver disease.
Yeah. So I'll kick it off with the conversation. So Alison, tell me about the APP's role in the longitudinal care of patients, kind of the unique position that APPs are in as a central point of contact for PBC.
So I think APPs, we play a vital role in that always wanting to provide appropriate information, but also being able to be a personal and very detailed individual care resource for our patients. I think we as APPs do a really good job of being able to find that happy medium between the two, making sure that we're not just giving information to patients for them to remember just during that one specific office visit, but we know that this is a chronic autoimmune lifelong disease, and we want to make sure that patients are not only understanding it for that visit, but what we expect and what we have to be able to keep them doing well long term. And I think that the more that we do education and the more that we give patients that upfront information in whatever manner it is that they can understand it and retain it, leads to, of course, patient compliance long term, which then, of course, leads to patients doing well. Tell me what you think about how you think are our best practices about how we communicate that and get that to patients in this complicated diagnosis.
Yeah. I kind of like to think of sometimes like the APP as like the quarterback of like PBC,
Sure.
And we do have time to spend with patients in our visits, talking about like why they have this condition, what are the symptoms that people have, what is the prognosis like? That's what people want to know. Like, what is my prognosis? And this isn't like a one visit check. We did the education. Next visit, we're just going to check labs and send you on your way. These are conversations that happen over time, and really you can kind of understand like what does the patient understand about their disease process? What can they do to control their symptoms? What can they do? How are they taking their medications? Why do they have to keep taking their medications indefinitely? And the more you have that time and you give them good information and education and allow them to ask questions about their health and the condition, it kind of builds that trust and patients will be more honest and open with you, and just kind of allows you to get better care of the patient.
Absolutely. And I think you brought up a good point of, every patient's different, right? So some people present with one symptom, some people never have another symptom. So how do we have and what kind of access do we have for patients in regards to where they may be able to get some info besides what we give them during that day, since it's so varied?
It is. And like I said, it's not like a one visit check, you're done. These are conversations had over time. But I think them understanding why they're experiencing some of the symptoms is so important. And then there's also medications we can use to help treat like pruritus and now we have some medications for fatigue for PBC. So really trying to make sure that they felt supported and that we're listening to them, that we can empathize with their symptoms, because these are symptoms that really affect your quality of life. Fatigue, pruritus, some of them have bone density loss, and anxiety around their condition. Some of them don't sleep well because they're up, itching all night. So really empowering them with medication, like they understanding why they need the medications, but then also connecting them with support groups. There's, the Liver Disease Foundation has several support groups and information online that are kind of geared towards patients for education, and also support groups online. So making sure that they feel supported in the office and also when they're at home.
Sure. And I think that brings up a good point. We talked about symptoms, patients being different, resources, but also every patient is different, right?
Exactly.
So we I think as APPs do a really good job of figuring out how each individual patient responds to that communication. Some people would like more reading material, other people would like more talking when they're in the office. And I think we do a really good job as APPs figuring out how we can get that complex patient education, empowering patients leads to compliance. I think that's an APP, like you said, going back to being that quarterback.
Yep. And having just a little bit more time with patients in the office to kind of address any of their questions and make sure they're understanding why they have to take a medication. It's essentially indefinitely. It also gives you kind of leading into like interprofessional collaboration. This is a very multidisciplinary process. And so how do you kind of talk to your patients about connecting them with other disciplines?
So I feel, lucky in my area. We have great relationships with our other consulting teams who we know help us with these patients with chronic liver diseases. So we'll use our own professional referrals. And then I will have patients who come in a lot with names of other consultants or other teams who will say, hey, I went on a website like the Center for Chronic Liver Disease, and I saw this name because I want to talk to somebody about the anxiety that I have because I don't sleep, etc., from the itching. So I do think that it's our role to be able to give patients our known resources, but then also within our own community to be able to have those open communications with other consultants too.
Absolutely. And I think it makes the patient feel and they're more cared for, right?
Sure, and empowered.
They're empowered. That could be from endocrinology if they have bone density loss, dermatology for the pruritus, their primary care provider, maybe a mental health specialist.
Absolutely.
It's so important. And we even lean on our pharmacy colleagues as well to help with cost of medications.
Absolutely.
And whatever we can do to support the patient, make sure that they are taking their medications, they're not having any issues with cost or side effects or anything.
Sure. And some of these drugs that we're talking about are specialty drugs.
Exactly.
So you mentioned our pharmacists, and typically that's a specialty pharmacy. And so it's important. Some patients have never been on a specialty drug before.
Exactly.
So to be able to kind of go over that and lean on our pharmacy colleagues, I think is super important too.
Yeah.
Yeah.
It's really clear that APPs play such a big role in managing PBC and connecting their resources. And I guess one of the last things is like how to communicate complex information. And I think this is something that can be challenging across not just for PBC, but for any process, any liver condition. It's how can we discuss labs, imaging, non-invasive testing in a way that the patient understands, but also doesn't cause like an undue alarm.
Absolutely.
Do you have any ways that you kind of manage that? Or
we're lucky we have televisions in each of our offices.
How nice.
That have great anatomy diagrams that I can pull up for many liver disease states.
Are they interactive?
We have a model that's interactive.
Very cool.
It's interactive where you can move your finger and you can see different angles, but not interactive like where it gives info or provides medical advice. But you can move it and you can, yes.
Incredible.
So to be able to explain to patients, I think visually, not just me talking about what PBC means and the itching, etc., but to be able to show patients what a bile duct looks like and what flows through a bile duct. And this is the reason why you become itchy, or long-term inflammation in the liver can lead to cirrhosis, and showing them what a picture of cirrhosis looks like. So I think that visual aids for me are tremendous help
huge.
when we're educating.
I'm taking notes over here.
For something that we don't see, right? Liver disease, very commonly, it's not like you can look at it and say, oh, I understand.
Exactly.
So being able to have any kind of visual aid model, I think, is wonderful. And then, you brought up the resources, obviously, that we have for patients. And I think that even in the addition of our education, when we're talking about models and pictures, etc., to be able to have that to back that up and have patients to see it again is super, super helpful.
Exactly. And I think like when communicating like about labs and results, I think it can get tricky because you want to make sure they understand why they need to keep taking their medications and what the goals of the treatment are. So if they're not at goal, that can kind of cause some panic. So I usually tell patients, especially if they're starting a new medicine, we're going to give it a little time. It's not going to work right away.
Sure.
And that these medications can hopefully slow the progression of the disease, and that, keeping a close eye on them is helpful, and we can kind of assess if they're progressing in fibrosis, but hopefully we can do all we can to slow the progression. And I find that even just giving the patients, like you said, like visuals and talking about it and just educating the patients about their disease process and the resources that they can have can kind of make it less alarming when you don't feel so isolated and alone and worried. So,
and I think that's where it goes back to, how do we as APPs continue to empower our patients is everything we just mentioned, right? We've got a chronic disease. These are the tools and methods that we as APPs who are kind of, I'll go back to your quarterback, taking notes.
The NFL just started
that's
back,
right,
so
exactly.
gotta throw that in.
That's our job, is to be able to, appropriately, maybe with a little bit of finesse, educate patients so that they're not alarmed by what we're telling them, but educated enough to be able to know that it requires continuous communication, follow-up, etc. And I think that in the setting of longitudinal care for patients who have chronic diseases, specifically PBC and chronic liver disease, APPs are vital in that role.
Well, this was really fun talking about how, the APP's role in primary care is so important, or in PBC is so important. It's been nice talking with you.
Absolutely.
And thank you everyone for joining.
Absolutely.